Welcome back to Healthy, Happy, Wise, Wealthy. I have with us today Dr. Fawad Mian, and thank you so much, Dr. Mian, for being here with us today. Dr. Mian is at the intersection of so many things that are so critical for us with figuring out, from what I've looked with you, is figuring out before we get sick, what can we do to stay healthy and well. So can you just start out, and I know you have a personal story of why you're a neurologist. What took you into the realm of some of the regenerative medicine and patient education and the healthcare initiatives, some of those things that you're doing?
Yeah, well, first, thanks for having me on the show. Deeply appreciated, and early start for you. Um, but I've been a neurologist since 2009, and initially when I started out, within a short period of time, I developed some injuries. And one of the first things that actually happened was I was lifting some weights in the gym. The weight slipped a little bit out of my hand, and it injured a small little joint in my shoulder called the AC joint. And I went to the orthopedic doctor because that's normally what you would do when your shoulder hurts. And the
Yeah.
orthopedic doctor, one of the first things he told me was, you know what, maybe we can get a surgery out of you. Maybe you have something called a slap tear. Um, that's just in English that basically means some cartilage tear like in your shoulder. And so that's what that was. Unfortunately, I had an MRI which did not show that because I didn't want surgery. I've had
Mhm.
surgeries in the past too as well for various other things. But there was a lot of arthritis in there, and so I had the doctor just well, actually not the doctor, the PA actually injected steroids into my shoulder joint twice. Still didn't feel that great. I couldn't sleep on my shoulder. I couldn't lift my arm above my head, or putting on a jacket would be a little bit tough. Putting on a shirt, and it was pretty miserable at the time. At the same time, I would also have patients come into the neurology office coming from pain doctors and other orthopedic doctors, and they told me, these issues are coming in are neurological. They're not orthopedic, nor are they really pain related. Go see the neurologist. And I would always scratch my head, like, this doesn't seem to make sense because it seems like they have these chronic musculoskeletal issues that are going on that may not be addressed. And so while all this was happening, one day I had gotten some new shoes, and probably like the second day I was wearing them, started walking, my foot just started hurting all of a sudden. And just to give you context, I did training in New York City for several years, so I was always walking everywhere in dress shoes all the time. And so I
Okay.
was using these shoes, and I'm in New Jersey now, and I'm walking around, and now my foot is starting to hurt. Like, that's odd. Those shoes must be really bad. So I switched up my shoes, but the pain didn't go away, and it kind of lingered. And I did what everybody else would do. I, put my feet up, iced it, stayed off of it, did all of that. When all of that was not helping, I went to the foot doctor. 'Cause again, that's what you do. You go to the foot doctor. And the foot doctor took some X-rays, gave me some expensive orthotics, which I thought would help. So I, and got them, which actually didn't help much things at all. It actually made things worse. But he said I had something called plantar fasciitis, which is just a way of saying that the tissue underneath the foot is actually irritated. And so I had gotten some steroid injections, just like I did with my shoulder. And I'd gone through one round, didn't work. Went through a second round, marginally worked. And then finally, I got the third round, and I was like, you know what? I think I'm 50% better now, at least. So I was like, all right, it just was the third time was the charm really didn't have an effect. And so I went to the gym to run because I wanted to exercise again. And that was actually a mistake because I ended up irritating my Achilles tendon, which
Hmm.
is the tissue on the back of the heel. I'm still
Jeez.
not 40 yet at this point, and all this stuff is kind of breaking down.
Oh
And I
no.
went back to the foot doctor. He did various other treatments, and things still weren't working out. As this was happening, it started changing the way that I walked because once things start breaking down, we're all kind of interconnected together. And so it changed the way that I walk. And so now my left knee was hurting. Just to give you background of my left knee, I tore my ACL around 2001 and had it surgically repaired. Or so I thought it was. And I was walking around, my knee was hurting. And I went to I basically had one of my colleagues write me up an MRI script after he looked at it. And I had an MRI of my knee. It showed just a little bit of fluid, but it showed that the ACL that was theoretically surgically repaired wasn't really repaired. And so it was just my knee was irritated. So between my shoulder, my foot, my Achilles, my knee, you can see like the downward spiral of everything that's kind of happening here, which is small little injuries that kind of keep piling up. And
Goodness.
so I would see similar things kind of also with my patients too as well. And in terms of the knee, I went to another orthopedic doctor and kind of just tugged on my knee a little bit without really looking at me, and said that he needed to scope my knee, see what he could look and see what he could do with that. And I was like, I don't really want to do that. It doesn't make any sense. I don't know why you would want to really do that for the injury that I have. Um, and so, between the shoulder doctor, the foot doctor, and this orthopedic doctor, they all kind of recommended surgery. The shoulder doctor recommended, you know what, you have some arthritis there. Maybe we just need to chop off part of the bone. Like, I don't really want to chop off part of the bone. I want to keep with what I came into this world with.
Yeah.
So I wanted to keep that. And then, the foot doctor was like, you know what, your Achilles is bothering you really bad. Maybe we need to shave down the bone. What really needs to be said is that it's, you got to detach the tendon, shave the bone down, reattach it back onto the heel. You're in a boot and you're kind of limping around or in crutches for like a good period of time. So it's not like just a small thing that's done there. It's a protracted recovery for something like that. And in terms of the knee, I don't have an ACL or anything like that still, but I kind of looked for alternative treatments. And, I stumbled on something called Prolotherapy a long time ago. And so I went
Okay.
to get some training out west. I'm closer to your neck of the woods over there.
Yeah.
And, I had some injections done on, myself at the time. I was learning at training. Um, and then as time went along, I learned about PRP within shortly right after that, 2012, 2013. And, I started implementing that as far back as then with my patients too as well, because I was tired of seeing all these chronic pain patients where they were told things were neurological when I really thought they kind of honestly, they really weren't. They were just, um, they were downstream effects from the injury essentially. And so I
Mm.
implemented that in terms of my foot and my Achilles. I had PRP into that for my Achilles several times because it was that bad. The plantar fascia got better. In terms of my shoulder, thankfully, I didn't opt for chopping out anything. I did PRP and Prolotherapy on my shoulder by myself to get that better. Where now I can sleep on it, I can throw stuff, I can put my jacket on. I don't have to worry about that. In terms of my foot, my ankle, I don't have to wear Frankenstein shoes anymore. I can kind of use the footwear that I wanted to use. And so as time went along, I slowly implemented this into my practice, and to the point where, I've treated several family members too as well. My own mom was quite skeptical of many different things in general. And, it felt like it was just a great alternative to people, for people who didn't want to do drugs or surgery. For myself, for what I did, I couldn't take pain meds all the time. I know that the non-steroidal anti-inflammatories that we take are actually detrimental overall to our health. The more that we take them, they can impair your immunity, they can impair your ability to actually heal. They can actually destroy your kidneys over time, which I've actually seen on a couple of patients a long time ago, kind of
Mm.
abuse them. And they increase your risk of bleeding too as well. And so you can bleed internally from them. And then some of them also have black box warnings for heart attacks too as well. So it's not something
Goodness.
you want to just chronically utilize just as a way to get by. And so this is when we integrated that. We also integrated more holistic based treatments in our practice as well. Because there are many patients who simply don't want to be on medication. So we integrate some level of functional medicine along with that in terms of trying to make everybody good, not only from the outside, but then also from the inside. Addressing that underlying issue, for this example, would be something like PRP, say, for instance, to help stabilize the ligaments, tendon, and joints would help eliminate something like that.
Well, Dr. Mian, thank you so much for sharing your wisdom with us. Can you tell people how to get a hold of you, how to book an appointment with you?
So there's prolohealing.com, for more on the regenerative side. So those are websites there, and you can book an appointment, give us a call through there.